Hi, could you introduce yourself and tell us a bit more about your background?
Yes, hi, I'm Dr. Scott Ganz. I'm here at the Academy of Osseointegration meeting in Orlando, Florida. I'm a maxillofacial prosthodontist practicing in Fort Lee, New Jersey.
How do you use Osstell today in your clinic?
I use Osstell, the Osstell device in my clinic almost every day because I'm a surgical prosthodontist. I place and restore my own implants, and having the opportunity to be able to objectively measure the stability of the implants is something that is invaluable to me in my practice. And so having the opportunity to be able to test the stability of each implant the day that it goes in, or the day that we uncover it, or to determine whether we're going to load that implant, I get that confidence by establishing an ISQ value at that time. And there's no other objective measure that I'm aware of that will allow me to have that confidence.
What are the main benefits you see from using Osstell today?
I think the main benefits of using an Osstell device is very simple. We need to be able to place implants and restore implants. And when we place an implant, and we've been taught that the torque value is what provides us with tactile information about implant stability, that's really kind of a fallacy because it only provides that information about frictional resistance the time that implant goes in. And so we really need to go beyond that and understand the true stability of that implant. And through the scientific measure of resonance frequency analysis, which is backed by over 800 scientific articles, that provides me with the confidence to be able to understand whether or not that implant is stable and whether I can restore it at that time, or whether I need to leave that implant to integrate longer into the bone. So it gives me a picture of that implant and the osseointegration process over a period of time, and in fact, perhaps the lifetime of that implant if I want to go back and test it.
All right. What advantages do ISQ value give you today?
The ISQ values are very advantageous, not just to tell us about implant stability at that time, but also obviously to track the progress of that implant over a period of time. The new IDX unit is really a wonderful unit because it provides us with a device that records the data. So we can also record not only the day that we place the implant, but we can record the manufacturer of the implant, the length and the diameter of the implant, and some other demographic information that becomes invaluable, especially when we're looking at following our cases over 1, 2, 3, 5 years. We build this data set that is invaluable to me as a clinician, and certainly to many others that want to track their patients over time.
What type of surgical protocol do you use today, and how do you decide which protocol to use?
The surgical protocol that I use in my practice is going to be based upon the individual needs of the patient. And to me, the way that I understand how to diagnose and treatment plan each individual patient is usually through the use of 3D imaging. And so we base everything on a cone beam CT evaluation. So we can understand, at least preliminarily, the shape and the size of the bone, the density of the bone, and we can then plan with interactive treatment planning software the angulation trajectory of the implant to best restore the patient to function and aesthetics. Of course, the goal of implant dentistry is not the implant, it's the tooth that we replace. And so first placing the implant and then understanding what type of an abutment and then what type of restoration we're going to do becomes the basis for our protocol. Whether we do an immediate extraction, immediate placement, immediate restoration, or whether we do a delayed placement where we bury the implant for several months and then uncover it separately, or even do it as a one-stage approach with a healing collar. Having an ISQ value at the time the implant is placed helps me decide which protocol is appropriate for that particular patient.
What do you think will change in the next 5 years in implant dentistry?
I think that the digital workflow is becoming more and more refined. I think the technology is improving rapidly. We have a wonderful, amazing variety of products for intraoral scanning, for desktop scanning, and merging that with the cone beam CT data set to provide us with better and more accurate assessments from the diagnostic standpoint, but also to where we need to go on the restorative side with the integration of CAD/CAM technology. So having a basis for understanding implant stability gives us more confidence to be able to take that digital workflow even further.
Thank you very much.
You're very welcome. It's a pleasure to be here.